Good morning, guys. Tony Maritato here. I had a couple extra minutes to spare, so I wanted to jump on, talk to you about the total knee replacement support group for kind people. I realize that I answer a lot of questions from this group on YouTube, but I've never shown you guys the group. So behind me on the screen, you can see this is the feed from the group. I wanted to scroll down here because there was a great question that came in right here from Lori. She said, which replacement is worse, a hip or a knee? So when we're talking about total joint replacement surgeries, I'm going to throw one more joint replacement in there. I'm going to talk about the total shoulder replacement. In my physical therapy clinic, we're primarily an outpatient orthopedic clinic. I treat all three conditions, but I can tell you that if you would have asked me this question 10 years ago, without a doubt, I would have said a total shoulder replacement is the most challenging, the most frustrating, probably has the worst outcomes of the three procedures, and probably is the most painful for certain patients. Now, that procedure has really changed. It's really improved. Now the total knee replacement has moved into first place for the most frustrating, most challenging of the three joint replacements. Hip replacements are almost like no problem. I probably don't even get 3 to 5 total hip replacement referrals in an entire calendar year. They're using an anterior approach to do hip replacements. Patients are up and walking. They're same day. They're doing amazing. Very few patients are receiving outpatient physical therapy services after a total hip replacement because the technology and the procedure has gotten so good. But total shoulder replacements, they are still coming to therapy. It's still a challenging recovery, but not near as bad as it used to be. Total knee replacements are still number one for the most challenging. Now, of course, there are those cases, the unicorn cases, where patients just do amazing. They walk into my clinic the day after surgery, and you would never even know they had a procedure done. But that's not the typical case. In most cases, patients are following the guidelines. They're going through the recovery protocol. And just to review the timeline, typically what we're looking for is the first 2 weeks after a total knee replacement. You're just recovering from the surgery. You might be a little bit anemic. You might have some problems with dizziness, with nausea. You might be getting fatigued more quickly than you're expecting. Your body is just recovering from the trauma of surgery. Weeks 3 and 4, you're really starting to feel the recovery. Now you're getting some improvement. You're off the walker usually. Maybe you're using a cane. Maybe you're not. Your range is improving. Usually you're looking at 90 degrees of flexion, full extension by week number 4. Not for everybody, but for the standard, for the people in the middle of the bell curve. And then between week 5 and 6, you're really starting to hit your stride. You're making significant gains. You might be doing better in week 5 and 6 than you were doing before surgery. And then typically for outpatient, you're looking at about a 10 to 12 week treatment program. Most of my patients are being discharged from therapy between 10 and 12 weeks. By week 23, 24, they're back to recreational sports and activities. Some patients, it might take 12 months for that, but the window is kind of dependent on how young you are, how athletic you are, how active you were before surgery. You know, there are patients that have been struggling for a decade with a knee that needed to be replaced. Meanwhile, there are other patients that are getting the replacements much sooner. So you really can't judge how somebody else does and expect to do better or worse than them. You are on your own path, your own journey. But I just wanted to share, you know, in my opinion, at least from what I've seen in my clinic, I would still say the total knee replacement is the most challenging. The total shoulder replacement comes in second place, and total hip replacements have been doing incredibly well. If you want to join the group, I'll put a link to the Facebook group down below. If you have questions, feel free to post them on YouTube, but I don't always get the time to come back and answer the YouTube comments. So a lot of times patients, clients, friends, family will join my Facebook group, post questions in there. We have over 10,000 members. And it's an amazing community. Many of them will respond and provide their experience, their guidance in ways that I just could never come close to since I didn't have a knee replacement. You guys did. I'll catch you on the next video.